Treatment for type 1 and type 2 diabetes mellitus. The treatment for type 1 diabetes mellitus involves insulin replacement therapy to regulate blood sugar levels and maintain overall health. This often involves multiple daily injections of insulin or the use of an insulin pump. In addition to insulin therapy, people with type 1 diabetes also need to regularly monitor their blood sugar levels, make healthy dietary choices, and engage in regular physical activity to manage the condition. In addition to these basic management strategies, it is important for people with type 1 diabetes to receive regular medical checkups, including monitoring for potential complications such as diabetic retinopathy, neuropathy, and nephropathy. They should also work closely with their healthcare team to develop a comprehensive treatment plan that meets their individual needs and helps them to effectively manage their condition over time. Treatment for type 2 diabetes mellitus usually involves lifestyle changes, such as maintaining a healthy diet and getting regular physical activity, as well as taking medication to help regulate blood sugar levels. Here are some of the common treatment options. 1. Lifestyle changes. Making changes to your diet, increasing physical activity, and losing weight if you are overweight or obese, can help improve blood sugar control and prevent or delay the progression of type 2 diabetes. 2. Medications. Several classes of oral medications are used to treat type 2 diabetes, including metformin. This medication helps reduce the production of glucose in the liver and improve insulin sensitivity. Sulfonylureas. This type of medication stimulates the pancreas to produce more insulin. DPP-4 inhibitors. These medications help increase the release of insulin in response to food and improve glucose control. GLP-1 receptor agonists. This class of medications helps lower blood sugar by increasing insulin release and decreasing glucose production by the liver. SGLT2 inhibitors. This type of medication helps remove glucose from the blood through the urine. 3. Insulin therapy. Some people with type 2 diabetes may need insulin therapy, either in addition to or instead of oral medications. Drugs used for type 1 diabetes mellitus. Type 1 diabetes mellitus is an autoimmune disorder that results in the destruction of insulin-producing cells in the pancreas. There is currently no cure for type 1 diabetes, so the main goal of treatment is to manage blood sugar levels and prevent complications. The following are some of the drugs commonly used for type 1 diabetes. 1. Insulin. Insulin is the primary treatment for type 1 diabetes. 1. People with type 1 diabetes need to take insulin injections or use an insulin pump to replace the missing insulin and regulate their blood sugar levels. 1. Glucagon. Glucagon is a hormone that raises blood sugar levels. 1. It is used to treat severe low blood sugar in people with type 1 diabetes. 1. Sulfonylureas. Sulfonylureas are oral medications that stimulate the pancreas to produce more insulin. 1. They are not commonly used for type 1 diabetes but may be used in combination with insulin. 1. Dipeptidyl peptidase 4 (DPP-4) inhibitors. DPP-4 inhibitors are oral medications that help regulate blood sugar levels by increasing insulin production and reducing glucose production in the liver. 2. Sodium glucose cotransporter 2 inhibitors. These inhibitors are oral medications that help lower blood sugar levels by increasing glucose excretion in the urine. Drugs used for type 2 diabetes mellitus. Type 2 diabetes mellitus is a chronic condition characterized by high blood sugar levels due to the body's inability to properly use insulin. The following are some of the drugs commonly used for the treatment of type 2 diabetes. 1. Metformin. Metformin is an oral medication that helps lower blood sugar levels by reducing glucose production in the liver and improving insulin sensitivity. 2. Sulfonylureas. Sulfonylureas are oral medications that stimulate the pancreas to produce more insulin. 2. They can be used to help lower blood sugar levels in people with type 2 diabetes. 3. Meglitinides. Meglitinides are oral medications that work similarly to sulfonylureas by stimulating the pancreas to produce more insulin. 4. Thiazolidinediones. Thiazolidinediones are oral medications that help improve insulin sensitivity and lower blood sugar levels. 5. Dipeptidyl peptidase 4 inhibitors. These inhibitors are oral medications that help regulate blood sugar levels by increasing insulin production and reducing glucose production in the liver. 6. Sodium glucose cotransporter 2 inhibitors. These inhibitors are oral medications that help lower blood sugar levels by increasing glucose excretion in the urine. 7. GLP-1 receptor agonists. GLP-1 receptor agonists are injectable medications that help regulate blood sugar levels by increasing insulin production and reducing glucose production in the liver.